You're watching Health Matters on Channels Television. Welcome to the program. It's time to talk about health. I am Yomi Otaiwi. Before we go into our focus on the program today, let me bring you up to speed with the COVID-19 situation in Nigeria. As at 13th of August 2021, 636 new COVID-19 cases were confirmed, and that's with 12 deaths recorded in 17 states. Lagos, the Federal Capital Territory, Kaduna, Plateau, and Rivers states are states with the highest number of confirmed cases. The total number of confirmed cases in Nigeria stands at 181,297, with 166,709 discharged, and sadly 2,211 deaths recorded. So remember, protect yourself and others around you. Please use your face mask. Regularly wash your hands with soap and water or use an alcohol-based hand sanitizer. Avoid large gatherings and keep a safe distance from anyone coughing or sneezing. And while the eye is on the ball concerning COVID-19, the outbreak of cholera in Nigeria is also of serious concern. Cholera is a bacterial disease which causes severe diarrhea and dehydration. The latest figures from the Nigeria Center for Disease Control show that 22 states plus the FCT have reported a total of 31,425 suspected cases of cholera, with 816 deaths so far. We'll be looking into the causes, symptoms, likely complications, and most importantly, how to prevent the people from contracting the disease. I have joining me from our Abuja studio an Assistant Director Surveillance at the Nigeria Center for Disease Control, who is also a member Technical Working Group on Cholera, NCDC, Dr. Hassan Muntari. Thank you so much for being with us today.
Thank you for having me.
Let me begin this way. Since the beginning of the year, states like Benue, Delta, Zamfara, Gombe, Bayelsa, Kogi, in fact, 22 states have reported cases of cholera outbreak. Cholera, as we all know, is waterborne. That is, the lack of potable water can be a trigger. What are the other factors driving the disease in the country?
So, thank you very much. As you rightly said, we have 22 states plus FCT reporting cholera cases from January to now, this year, with 816 deaths. Factors driving cholera in Nigeria, one of them you mentioned, which is inadequate or lack of potable or safe drinking water, which is a very, very important issue. The second is the culture of open defecation that we have in our communities. Because most of these communities that cholera affects, you will see that there is a practice of open defecation. As you know, we are trying to achieve open defecation-free Nigeria, but most of our local governments, 774 local governments, most of them have not achieved that. We are far from actually achieving that. So that is another factor. And also the lack of, hygiene practices that we have, either individually or, in a household. For example, you see people, disposing of waste, behind their houses, and then, not really taking care of the waste the way it should be. So that also contributes. And people are not washing their hands, as regularly as they should, with running water and soap, and or use hand sanitizers. So these are some of the issues, and coupled with the fact that probably there should be more investment in, from either the states, in terms of provision of potable drinking water, and environmental sanitation and hygiene, and then, as we mentioned, to make sure that people comply with the fact that they have to have a facility, toilet facility where they can, ease themselves, not to, defecate openly, which definitely contributes to cholera outbreak annually in Nigeria.
We'll come to the issue of infrastructure provision, of course, talking about water. Let's talk about the transmission, of course, human to human. We've talked about water. Tell us more about it. How is this, transmissible?
Yeah, so cholera is highly infectious. Usually it's a waterborne disease, foodborne also. If water is infected or food is infected with bacteria, that is a vibrio cholera, which is the bacteria that causes cholera. So if somebody ingests this, he gets infected with cholera and he develops symptoms. Now, these symptoms basically is acute, onset of watery diarrhea. It's acute and it worsens so rapidly that if care is not taken early, or if care is not if we don't seek for care early, it can lead to a lot of complications. Somebody can also have weakness because of a lot of fluids that the patient loses. So you can have vomiting, body aches, and a lot of constitutional symptoms that is associated with losing a lot of fluids, a lot of weakness, you understand. So these are the symptoms that we expect from somebody who has, been infected with cholera. And it's not everyone that, gets infected with cholera developed severe symptoms. Majority of the people become asymptomatic or just mild symptoms like mild diarrhea. But, so the few that develop severe symptoms, definitely they need, to immediately seek for medical attention.
So you've said that it's not everyone that would come in contact with the bacteria that would have severe symptoms. What makes that difference for those who come down with it?
Yeah, so as we know, we have individual differences. You can have comorbidity, for example. If somebody with, for example, HIV, AIDS, diabetes, anything that can compromise immunity, and then, so if we all get infected with these people, they are likely to develop symptoms more than the person who is healthy, who has, his immunity is stable, so he may not necessarily develop the symptom. So it depends on individuals. That's why some people, and it also depends on the volume of the pathogen that you ingest. For example, if somebody takes water or food and with a lot of high dose of the bacteria, is likely to develop symptoms than somebody who has taken, small dose of the bacteria in a water. So there are a lot of factors, but essentially, people develop symptoms and some do not.
Now, let's talk more about the transmission. So we say it could be from water or contaminated food. If the water is boiled to a certain degree, or the food is hot, is it still something that can predispose an individual to having cholera? Yeah,
so what we always expect is, if we boil the water, we usually have a container that we keep the water and cover it, for example, if it is not a safe drinking water from the beginning. Now, if we do that, it is unlikely that we will come down with cholera. But the problem that we usually have is the water is not safe. For example, as I mentioned earlier, people do open defecation or get rid of their waste, inappropriately. And then when we have water wash all this dirt to probably a stream where people also uses it to drink, or without boiling or without treating it at home, so people can come down with cholera.
Move on to talking about, some of the... We have 22 states dealing with cholera right now. How often or how soon does the NCDC get, notification of some of this, what the situation is with each state?
Yeah, frankly, we get regular situation reports from states. The NCDC has activated the Emergency Operations Center, which consists of all the partners as members. For example, Federal Ministry of Water Resources, Federal Ministry of Environment, the National Primary Healthcare Development Agency, our partners like WHO, and all other stakeholders like National Orientation. They're all members of the EOC, that's Emergency Operations Center, that we coordinate, and we now sit down every week to make sure that we look at way forward on how to support states to contain the cholera outbreak. So we get situation reports almost on a daily basis from the states, and we know what is going on in these states. So that is the status. We get reports every day.
So why does it seem that, over the years, cholera is not alien to Nigeria? We've had, cases where, over the years, we've been having huge number of cases of cholera. Why does it seem that we can't have a lead on it? Every year, once it's the rainy season, we have cholera. Why?
Yeah, thank you very much. That is really alarming, and it's really concerning to everyone. Nigeria is cholera endemic. We are all aware of that. So it happens every year. So the issues at hand, which we have mentioned earlier, is that we have issues with safe water. So once that is not resolved, we'll continue to have cholera every year. We have issues with open defecation. We were only able to achieve, I think, about 61 local governments out of 774 local governments open defecation free in Nigeria. So you can see we are a long way to go, but Federal Ministry of Water Resources are doing all they can to make sure that this is, achieved, before, because the roadmap is by 2025 to achieve open defecation free in Nigeria. Now, so these are the issues.
If the roadmap is 2025 and we are in 2021, how far would you say we are from achieving this?
Yeah, as yesterday I was listening to one program. The 61, we achieved that fairly rapidly. So we expect that probably to be faster to achieve. But frankly, there is no time. This is 2021 and 2025. But I believe Federal Ministry of Water Resources will be able to give more details on this.
So now let's talk more about the infrastructure part of it. We need potable water. We need, of course, conveniences for people, whether in public places or even concerning housing. Now, this is, of course, is not what NCDC is going to provide. So let's speak to the issues here. The state government, the federal government, you've mentioned the Federal Ministry of Water Resources. What is it that you're getting from them in terms of the challenges in providing some of this infrastructure?
Yeah, so frankly speaking, both federal government and the states are investing hugely in terms of provision of water, safe water to the populace of the states, the campaign against open defecation. In most states is ongoing. Enlightenment programs on what people need to, and people need to understand that they need to have personal hygiene, is also ongoing in the states. So, but, there are a lot of competing needs. So we are also trying to, we are in the process of advocating to the state governments to increase funding to these wash infrastructures, so that, and they should work also, with the Ministry of Health, should work with the Ministry of Environment, Ministry of Water Resources in the states, Rural Water Supply Agency in the states, to make sure that at least they accelerate the provision of these infrastructures to the communities in the states. Because, as I mentioned earlier, cholera is endemic. Once there is no, investment, serious investment in this wash infrastructure, that's water, sanitation, hygiene, then I think it will be a mirage for us to think that cholera is going to be, eliminated in Nigeria.
I'm sure that's not good news for many Nigerians that, we are still very far away from achieving or being cholera-free. But we'll go on this quick break. When we come back, we'll talk more about prevention and, of course, when cholera needs to be treated as fast as possible. Do stay with us. Thank you for staying with us. It's Health Matters on Channels Television. You can join us in this conversation if you have your question, if you have your comment, if you have gone through cholera before now and you want to share your experience, you can call us on 0808 054 2233. The number, of course, will be on your screen right now. Let me quickly go back to Dr. Muntari in our Abuja studio. I said we're going to talk about prevention. Now, we know that cholera can be very fatal, as you've mentioned. When, how, or where should the treatment begin from?
Yeah, so thank you very much. Once somebody starts to develop symptoms, you understand, so he should seek medical attention. Because, as you rightly say, the cholera is fatal if not treated early. So the fatality rate could be up to 50% if care is not given, if somebody does not receive care early. But if somebody receives care, it can drop to less than 1%. So you see, the impact is so clear. So once somebody starts to develop symptoms of diarrhea, acute watery diarrhea, then he should seek medical attention so that he will be diagnosed at least once in a community where we don't have a cholera outbreak, for example. He will be diagnosed and then he will be treated accordingly. Now, when you have cholera outbreak in a particular community, once you develop diarrhea, acute watery diarrhea, then it's considered to be cholera. So we expect somebody to seek medical attention, as soon as possible when he starts to develop symptoms of acute watery diarrhea.
And is this something that, for instance, if someone starts having those symptoms that you mentioned, can stay at home? I know there's been talks around oral rehydration solution. Is it something that one can treat at home or must get to the hospital as fast as possible?
Yeah, the most important, especially now that we have this outbreak in Nigeria, is good you rush to hospital and seek medical, because you will not know how fast it will deteriorate. So it is advisable that people go to hospital, seek medical attention, seek medical advice. The medical doctor or health professional will tell the patient exactly what to do. As I told you, it depends on which stage it is. If it is just mild symptoms, maybe he may just need to take oral rehydration solution. But otherwise, he may have to be admitted at the cholera treatment unit or center, as the case may be, to receive appropriate treatment, including IV fluids, which we mentioned earlier that the danger with cholera is you lose a lot of fluids over a very short period of time, and it can cause a hell lot of consequences.
Okay. Let's be joined by Blessing from Jos. Hello, Blessing. Thank you for joining us.
Hello. Good afternoon, ma'am.
Thank you for joining us. Please go ahead with your question or comment.
Okay. I just want to contribute and agree with the program. Okay. And I really want to appreciate the program. That I want to say that it's really timely, because the outbreak of cholera has to get to the lowest masses and the poor income earners because of their way of life and how they have their poor sanitation and poor source of water.
Thank you, Blessing. Thank you. Thank you for your contributions. Doctor, so you've talked about the fact that one needs to get to the hospital or a health facility as fast as possible. Tell us what the oral rehydration solution would do in the treatment of cholera.
Yeah, oral rehydration solution is, as is mentioned, is oral. You take it, you mix it with water. There's a particular portion depending on the quantity you are using, and then you start to use it, drink it, as you are drinking water over a period of time. It replaces the water, the fluid that you lose with electrolytes that you have lost when you are having the diarrhea. So if it's a case that you have mild case of diarrhea, so you can use oral rehydration solution to treat a patient, maybe in combination with other medications. But if it is a severe case where we have a lot of, the patient has lost a lot of fluid, as we mentioned, and we still mention that the consequences of having a lot of watery diarrhea is it will cause the patient to lose a lot of fluids. So the priority is to replace that fluid. So oral rehydration solution replaces the fluid the patient loses.
Okay, Angela from Lagos, thank you for joining us. Okay, I think Angela is gone. We hope that you can join us again on the show before the end of the program. Doctor, let's quickly talk about vaccination. Is there vaccination for cholera?
Yes, we have oral cholera vaccine. It's usually given 2 doses. We have, in Nigeria, we have a vaccination plan since 2017. The vaccination started, as a pilot in Borno State. And in this current cholera outbreak, we were able to vaccinate the community in Bauchi local government area. I think about 1.5 million doses were administered first and second doses. And then
how widely available is the vaccine?
So there's vaccine, and we are administering to some local governments.
How widely available is this vaccine?
Yes, that's a very good question. The vaccine is not really that, the amount, the quantity that we need is not available. But we are working with the International Coordinating Group and the Global Task Force on Cholera Response, or Cholera Control, with the National Primary Healthcare Agency and all other partners that support the cholera response in Nigeria and globally, to see that we get more doses of cholera vaccine.
Okay, in closing, Doctor, what would you want our viewers to take away in terms of prevention of cholera?
Yeah, thank you very much. That is very important. Our viewers should know that this is a multi-sectoral approach in terms of cholera, because no government can handle cholera alone. People have to cooperate with government, just the way people cooperated during COVID-19 pandemic. So any other disease like cholera requires that support from public, because if people can be disciplined not to open defecate, if people can get water and boil it and store it appropriately, people can get chlorine taps and purify their water at home. People imbibe a culture of hand hygiene, particularly very important with drinking water. With running water and soap, and proper sanitation. So I want people to really understand that most of these things is something that they can do themselves.
On their part.
Then, of course, government provide other infrastructure like treatment units, like vaccine, like deployment of boreholes, as a sort of, a source of water, safe water supply. So I want people to understand, and then, of course, when they take that responsibility, it is easier for government to deploy these infrastructures, and then they can also be used by these people.
Okay, thank you so much,
sometimes you can
Doctor.
deploy
Thank you so
infrastructure
much
and
for your
people may not
time.
use it.
I know cholera is what we'll still need to talk about until we achieve what we need to achieve in terms of ensuring that we don't continue to have cholera breakout every year. Thank you so much. We've been speaking with Dr. Hassan Muntari, is the Assistant Director at the Nigerian Center for Disease Control. Thank you so much. And that's the show for today. Thank you for watching. I am Yomi Otaigbe. Do stay safe.